to get started? Great. Good evening, everyone, on this Health Day at COP30. I'm Estelle Willey. I'm Director of Health Policy at the Rockefeller Foundation. And I'm really delighted to welcome you today to the session on Adaptation in Health, Financing Solutions for a Resilient Future. And we're really here to talk about an issue that's too often overlooked in climate finance forums: health. Because health is not just a consequence of climate change, it's one of the clearest, most immediate signals of its impact. Rising temperatures, extreme weather, and shifting disease patterns translate directly into people falling ill, health systems under pressure, and communities facing deepening inequities. Extreme heat is now killing one person every minute. And yet health is still treated as a peripheral in climate finance. And that's a mistake. As the evidence increasingly shows, health isn't a co-benefit. It's a frontline strategy for climate adaptation. And that's why today, and the report that we're launching with Gavi and AIIB is so timely. It offers a practical framework to rethink how we value health investments. It's not just good health policy, but an essential, cost-effective climate adaptation strategy. And it also shows us that interventions like immunizations, resilient health infrastructure, and rapid response systems aren't just saving lives, they're smart climate action. In fact, health initiatives targeting infectious diseases are among the highest return on investments in climate adaptation. Today, we'll hear from leaders from across the development, finance, global health, and country partners about how we can better align financing flows, scale what works, and ensure that vulnerable communities are protected as climate risk grows. The need is urgent, the opportunity is enormous, and the evidence is clear. So let's dive in. I have four wonderful panelists today. First, on my left is David Kinder, Director of Development Finance at Gavi, the Vaccine Alliance. Then I have AKM Sohail. He is the Chair of the International Climate Finance Cell in Bangladesh. And we have Dr. Agnes Suarez, who is the Director of the Department of Environmental Health, Surveillance, and Worker Health in the Ministry of Health of Brazil, and the architect behind this year's COP30 Health Day and the Belém Health Plan. And last but not least, we have Ajay Pandey, who is the Vice President of Investment Solutions at AIIB. So David, let's get started with you since you're right here with me. Do global health institutions like Gavi have a significant role to play in supporting countries meet their adaptation goals?
Thank you very much, Estelle, and nice to be here with all of my panelists. So look, my answer to that question is, of course, absolutely yes, we do have a big role to play. And I think you're right in your introduction when you said often health has been one of the more underlooked parts of climate and action that we taken, and want to pay tribute to Agnes and all of the work that Brazil has done, including the Belém Health Action Plan. I think that really is putting a spotlight, and having this COP Health Day really is crucial. I mean, certainly here at Gavi, we see climate change as a health crisis. Estelle, you mentioned it as well. We see rising temperatures, more extreme weather events. And what that's doing is really increasing the spread of infectious diseases. And many of the diseases against which we vaccinate children all over the world in Gavi, the Vaccine Alliance, we're seeing examples of the greater spread of malaria, diseases like dengue, yellow fever, and they really do disproportionately hit low and lower middle income countries at the... Thank you very much. There's always technical issues. I mean, just three examples of that from the statistics that we look at, of kind of how that impact is happening. So in Malawi, following the really substantial cyclone in 2023, which displaced 500,000 people and destroyed and damaged over 80 health facilities, it actually led to an outbreak of cholera in all 29 districts of Malawi, which was including actually in many of those districts that had been free of cholera for an entire decade beforehand. And then the catastrophic flooding in Pakistan in 2022 actually led to a 5-fold increase in malaria cases in the country in the year after, so 2.6 million cases. Mr. Sohail and I were chatting earlier on, and Bangladesh is an example where in the last 3 years, dengue mortality has increased by over 600,000. So we are really seeing these impacts on the ground, and it's why adaptation is really, really important. And this is really why we're here and why we're really excited to launch the report in front of everybody today, which has been jointly commissioned by Gavi and AIIB with the support of Rockefeller Foundation. And what we're trying to do to really take the health and finance and climate nexus to the next steps is put an accountable framework around what the quantifiable benefits are of making investments in health to build climate change adaptation. It's a very, very insightful report. There's lots of country examples, but I think much more importantly for that partnership perspective is it details in area by area across immunization and health systems how you quantify the benefits of doing things like having early surveillance of diseases so that and weather events so that before there is a flood you can pre-position vaccines and use stockpiles. It looks at the benefits of routine vaccinations against diseases on the rise and really puts that into a framework that can help us at Gavi work with partners like the AIIB, Brazil, Bangladesh and others, put together projects and really ensure that more finance goes towards linking health and climate together.
So let's dig into the partnerships bit. So Sohail, when we're talking about partnerships, Bangladesh has a really great one with MDBs like AIB and international health institutions like Gavi. Could you give an insight or example or a success story of how Bangladesh is tackling adaptation challenges through these types of partnerships?
Thank you, respected panelists and distinguished guests, ladies and gentlemen. Really, Bangladesh is one of the most vulnerable country in the world, 9th most vulnerable country in the world. And we have got a huge population, second largest climate exposed population in the whole world. And almost all the climate stresses are there. Other than the volcanic eruption. And last year, we experienced the very prolonged flood. I didn't see this sort of flood in my lifetime. That is it prolonged for 5 months. So what we felt that the climate stresses, extreme events are recurring, consistent, and scaling up. So it's very challenging to face by the government alone. So partnership is needed, but what sort of partnership, that is very important. Because by this time, Bangladesh, we have more than $100 billion loan. And last year we paid from Ministry of, as we deal it, we paid $4.77 billion for repayment. More than $1.5 billion for the interest only. And whatever the climate finance we got, that is 90% is loan. This $4.77 billion is equal to simply 16.9% of our revenue generated money. So because of this huge amount of loan debt, what happened that our fiscal space is shrinked. We couldn't pay more attention, adequate attention for the health. We spend only 3% of our revenue generated money for the health. whereas they spend 16.9% for the repayment. So partnership must be redefined. Partnership is not that we will be indebted. And some of our African friends, they are spending 25% of their revenue generated money for repayment. So time has come that we have to rethink. So we have to reinvent the mechanism, modalities of partnership. So the way Gavi is helping us, this is the real model for Bangladesh. That very focused, and there is no substitution of immunization because of the heat stresses, all the vector diseases has been increased throughout the world, not only in Bangladesh. So our request will be to our development partners. We are very happy that Vice President AIB is here, and he's going to Bangladesh next week with his whole team. So this is the prelude of our partnership. That is, we need to go for equity investment, not loan, co-financing in some cases with the government. And at the same time, the health sector, you will be surprised to know that in southern part of the Bangladesh, 4.4 million women are suffering from the early hypertensive diseases and the cancer in the reproductive health because of their salinity intrusion in the water. So in the adaptation case, we need more of Gavi-like partnership. And some cases we can go for adaptation, reinvent the adaptation business models, where it can be the social business model would be the best for that. Business model, other economic business model, those are driven by the profit. But health issue cannot be solved by that for the vulnerable country like Bangladesh. So social business model would be the very good example for that, and we can go for that sort of partnership. Thank you.
Thank you so much. Dr. Agnes, when countries are asked to do more with less, as Sohail was just explaining, how can funders adopt, what strategies can funders adopt to really maximize the effectiveness and impact of their adaptation financing? What are the considerations, you would say?
You know, when we talk about strengthening adaptation funding, we are talking about a lot of strengthening because adaptation has been really underfunded. And if you look in terms of what goes to health adaptation, it's even less. So I know there are specific solutions that we should be doing already, and we are not we pursue universal health coverage, and we have not done it yet. So Brazil has the largest health system in the world, and still, we know there are areas that it still needs to be covered. So this is the part that we need to do anyway. Do you know why we need additional funding for adaptation? Because it was difficult. It is still very difficult. And we have a legacy of inequities that we need to deal with. And climate change is, I think, the strongest accelerator of inequities. It creates as well, but it accelerates inequities. Therefore, when we put a plan like the Belém Health Action Plan, where the first lens we put on is equity, and the concept, together with the concept of climate justice. and we say, sorry, we cannot do it alone. We need social participation. So it's everyone together. So this is cross-cutting. We can do everything, technology, new developments, new ideas, new things. This is perfect. But without putting this lens of equity and this lens of social participation, it's difficult to get there. So what really we want to fund things that are useful, that will make the huge difference. They need to listen the needs to the country. So there is no silver bullet or golden bullet. This is something that is complex. So we need everyone understanding where the needs are. And the needs within a country can be different in the north, the south, and between countries even more. So we need this different way of working. So funds, we need resources for capacity building, but we need also investment funds of different ways, combination of funds. And one way of looking at it is looking what are the priorities, not a vertical priority, like let's eliminate malaria every country, but malaria is not even a disease in some countries yet, I said, because it may come. Like dengue, we didn't have dengue in the south of Brazil. Now there is no place in Brazil without dengue. So this is what climate change increases in terms of needs. So if you want to spend good money, you need to listen to what is needed, and the people need to understand what they need the money for, and what we need, what type of capacity is needed in each place. And that's the reason, if you look at the Belém Health Action Plan, it gives the guidance to do that. So it's the coverage. So it's a smart way of putting your money in the same direction, everyone, but looking at the specificities and accelerating the solutions that are there. And I saw that very quickly, the report. So it's like translating it into what it means now. So I say, this is what you gain. But vaccine, we knew already. This is a basic public health priority. But why we need to do this in terms of, because we have climate change, that's the part that it's not acknowledged yet. So that's the part we need to cover. All the rest we need still to do, but now we need to do more. And that's the reason we need more investment on that. So it's not so easy. And I can tell you, we are here in the Amazon. I don't know if everyone here was in the morning. And I came here from a session that was discussing our plan at the Adaptation we presented. And then there were two people who were speaking from the Amazon, the state of Amazon, and the state of Para, and telling what it means for them to do this, what we're talking about. And that's amazing when we see. One thing is to think we need to vaccine and we need to decrease emissions, but the cost to bring vaccines to everyone in the Amazon is different from the cost in Sao Paulo. And that's what we need to account for, and to keep the vaccine in place so no children in any place will miss the vaccine. That's what we need to think about. So the specifics of the plan are important, and that's the reason this type of reports, or if I am an expert in vaccines, I will look at from my perspective what needs to change in terms of funding, of financing, of increasing capacity, in terms of distribution, of cold chains, logistics, supply, everything. Make a list and then see, this part I need more money, and I need more knowledge, and I need innovations, new vaccines, or new ways of producing vaccines, new ways of distributing it, and increasing capacity, so I don't have to import everything, this type of things. So thank you. I already spoke too much.
Thank you so much. Ajay, all eyes are on MDBs now that donor funding has been cut. And so it does feel like a lot of burden has been placed on you all. And so when we see the adaptation gap report, for example, that just came out recently, just showing this how significantly underfunded adaptation is compared to mitigation globally. What is AIIB doing or planning to do to, leverage your suite of financing tools and instruments and modalities and bring in external resources to really scale up that adaptation finance flow? Yeah.
So first of all, thank you very much for having this discussion. And I am really very thankful to Gavi and Rockefeller Foundation for having a collaboration and having this launching this report. It's truly very, very useful report, and that is going to set a new direction in which we are going to collaborate and work further. The question that you have asked about the AIIB, the adaptation, what are we doing? Let me tell you the overall perspective, and then I will come back to particularly the health aspect. The AIIB is an infrastructure investment bank, and we are not just an infrastructure investment bank. We are doing only the sustainable infrastructure. Each of the project that we do, we give a policy assurance that it is Paris Agreement aligned. And this is as per our articles of agreement. So we have 110 countries as our shareholders. Bangladesh is one of them. So we give policy assurance to our board that each of the project that we undertake, it is Paris Agreement aligned. We have also another goal, that we had a goal that by 2025, our climate financing will reach 50% of our total financing. However, we achieved this target 1 year before. So in 2024, we not only achieved this target, but we exceeded this target. So our climate finance goal was 50%, but we achieved 67%. And out of that, the mitigation was 72% and adaptation was 28%. So imagine, almost 1/3 of our climate finance goes towards adaptation. So this is the kind of emphasis that we are placing within our own bank, and we are so much conscious of this fact. First of all, the AIB could also be called climate bank, because when we are saying that each of our project is Paris aligned and our achievement is 67%, it is a climate bank. And out of that, 1/3 goes towards the adaptation. So this is our emphasis. Our infrastructure, people generally, sometimes they think that infrastructure means in the road, power plant, energy. But we consider health as an essential part of our infrastructure. We have come out with our health strategy. Imagine, Asia Infrastructure Investment Bank, which is supposed to be infrastructure bank, comes out with the health strategy, and working with a partner like Gavi, Rockefeller Foundation, and trying to see what we could do in the areas of health and every other possible areas. We are also, in fact, you look at some of the financing that we have done, some of the particularly, one of our major investment, during the COVID time, in this, the crisis, the CRF funding that we gave to the government to get resilience so that they can deal with that situation. So that is what, we did this. So it was one of our major financing to the sovereign governments. We have invested in many health projects, the hospitals, the energy efficient equipment, and also new ways of dealing with the health, like the telemedicine and bringing the digital infrastructure into this. Because what we feel that if you are going to tackle health, and which our panelist from Bangladesh was mentioning, it's indeed a problem. Because if you are going to deal with this problem only from financing point of view, it is not going to be sustainable. What we have to find is the smart solutions. And let me give you some example. Before coming to AIIB, I used to work for the Indian government. Almost three and a half decades, I worked in the Indian government at various levels. In many of the assignment, I actually dealt with health, public health. So I am aware of those ground realities. The question of affordability. How do you bring down the cost? How do you make the system very efficient? So in this digital age, let's say if we start using telemedicine, telediagnosis, electronic medical records, and also improve the supply chain, we can see the impact on the cost. And then, the country which have to borrow a huge amount of money, that itself, can come down. So what is required is a very, very holistic approach. Similarly, if you are using digital technology, I mean, at least I can say many of the developing countries, emerging, global south, people go to a doctor, he will prescribe certain tests. You do this test. After 1 month for another disease you go, many of those tests get repeated, right? There is no system of any electronic medical record. So everything starts with a de novo, and then, so that is what one should be trying to build, and that is why, the electronic medical record. Similarly, the digital surveillance. If you are having a strong surveillance system, you can have an early detection. Your intervention could be very less costly, and you can contain that disease. These are some of the measures through which, the intervention could be there. It could be cost effective. Entire the supply chain, the cost could be done. One of the, when I was working in the Ministry of Finance in India, one of the scheme was launched was, the Jan Aushadhi Yojana. This is what, the entire supply chain was, improved, resulting in the cost of medicine coming down by almost 60-70% down. So imagine, and this was done all over the country. So I think, there are many successful, many examples present there, and how some of those experience can be replicated in other parts of the other parts of the global south. I think this is what, as a the partners like us, when I look at the panel and I say that, look, we have the government, we have the financier, we have the Gavi concessional fund, and we have a technical the knowledge with the Rockefeller Foundation. I think, if these four actors, we represent the four different streams. If we can come together, and we are already working with Gavi, how to, in terms of immunization, what kind of a financing model could be. So one is that use technology to bring down the cost, make the system very efficient, make your logistics very efficient, and blend the concessional finance, use the knowledge, get the policy support from the government, because that is again a very, very important thing. That, government, I have worked in the government, and the kind of fiscal constraint that he was saying, I used to be the finance secretary of India, so I know what is the fiscal constraint of the countries. So what the government can do, more than the actually taking loan, can come out with the right policies and the right systems. That could be the biggest contribution from the government side. And then, we can come as a finance, the concessional finance, Gavi, and then the knowledge. I think, these four pieces, if we can work together, I think, we can do a lot in this area. Thank you.
Thank you. That was great. It's almost like moving from aid to real investment when we start with country priorities, right? From the policies. I want to stick a little bit with the digital transformation that you were talking about and go back to Dr. Agnes, because the Belém Health Action Plan really showcases in Pillar 3 the innovation, local production, and digital transformations that we all can invest in to improve health outcomes through climate adaptation. So they're critical drivers. So can you talk a little bit more about how the Belém Health Action Plan really helps translate these priorities into concrete actions?
Well, that's the part that comes, I believe, that what everyone here has already said.
Okay, but what are your hopes and dreams? What do you
My
think?
hopes and
Yes, but
dreams
how
are
do you
that
think it's going to
everyone-
translate then?
I think we put it all together today. I still am very emotional for today because I think this is something of achievement of the health sector. And I think Brazil has put as a proposal, but I think it's a collective achievement because we said, I keep the numbers and I say it's one solution because it's making the health systems resilient. But I always say resilient, it's like you have an elastic and then it goes, there is a limit to do that. So that's the reason we learn the language of climate conversation and then we influence as well. So it's always a way of entering the conversation. But I think the plan, when it puts all these things, nobody else in the climate agenda can do that. That's the health sector. However, if we do that and we said it's one solution, two cross-cutting priorities, three lines of action, but we have 15 outputs and 60 actionables, everyone can feel somehow linked to the plan. And I say frequently, I was asked before, and what is the role of the private sector? So I'm sorry, I am from the public sector. Of course, I build things that are public. I build public goods, and that's what I want. But the private sector can build public goods. So think about things that will add to that. And one thing, and I think it was mentioned here, innovation, it can serve the ones that are already well fit and they will survive to, look at the flows, who suffers the most. And even in the aftermath of disasters, there are the ones that have families and resources and they recover. And who are the ones who are left behind? So that's the reason we need to think that when we do the investment in innovation and production and digital health, we're saying this is not because to make it beautiful, like the most modern, but private health services. These are the ones that are needed the most to make our dreams come true of universal health coverage, of vaccines to everyone that needs. So that's what the plan is about. So there is a role for everyone in this innovation and production. And I would say digital health, they exist already. And I read many things about this. There are things that are not there because they are not needed by the rich, but they are needed by the poor. So when we identify that, so local production, having a different way of a distribution, it's not a matter of if you say this is the health care facility will do that. No, this is done by big companies, but the health sector is a big buyer. So if you say less packaging, more efficiency, and more resilient products, then this will help everyone, but you have to fit into this plan. Like this has to fit into the needs of the country. I know what is needed in my country in details because I'm responsible for it. But for sure, if I'm working in one region, like I was mentioning today, the details and the solution that is being built in some of the places, they're amazing. You know, putting all what we know, but using the local knowledge, for instance, for less need of air conditioning, but it's still, you know, nice to live and nice to work. And these things that are, you know, this is innovation. What I think it's really clear in this third part, and that's what I've heard a lot about, is that the message is, it's not doing the same way we're doing and then just doing more and saying we are doing this because of climate change. It's not. It's thinking what we need to do differently and do differently, and then we'll plan and do differently because of climate change, and it will make us meet our targets, and that will even improve our possibility of meeting targets and making targets that are even more dreamers, dreaming more about reaching the successes that we need for all programs. I always think about everything because it's not climate sensitive disease are all diseases. Some are you can prevent with vaccines, and this we should work on that. But there are diseases that cannot be preventable, and in general, all diseases are socially determined. So, what are the actions that we need to do in the health sector? The Ministry of Health needs to do. These are the most important. So that's what for us. And then because of that, we'll have a whole bunch more of people understanding what climate change is, and we'll for sure be a powerful motor of change also in the discussions of climate change in general. So mitigation will become certainly a priority that will count on the impacts on health when deciding what to do. So let's keep it in 1.5, but let's do our part to make people survive to that as well. Thank you.
Great, thank you so much. So, Hale, how can national and local actors coordinate better to ensure adaptation investments reach the most vulnerable populations? I think Dr. Agnes was in Rio last week, where mayors were stepping up to the challenge, but you know, the subnational and the national levels and that interconnectedness is really important, but also kind of hard to do. So, could you just tell us a little bit about how Bangladesh is thinking about that? And also your unique role in the the climate finance cell, and how does that help address that?
Thank you very much. Once again, we are very optimistic that the development partners, they are targeting the 50% is the climate finance. What Mr. Vice President told. So our request will be, it will be very helpful to coordinate the national and local level because we need more finance, undoubtedly, and that finance has to be the concessional finance, and the concessionality has to be defined. The concessionality cannot be the more than 6%, 7%. The concessionality has to be minimum less than 2%. And for the vulnerable country, we request that the concessionality should be defined at less than 1%. Especially the most vulnerable country, like most 50 vulnerable countries, they deserve the concessional financing. For the health sector, less than 1%, 0% interest. Debt swaps are needed. So what we do expect that Mr. Vice President told that the logistics must be a smart one. The policy support has to be there. If the country is vulnerable, most of the cases those are not that smart. It's the common. So, so we have to assess the reality, call a spade a spade. So, a separate health NAP, which is wrong. I do believe that health must be within the NAP. Otherwise, it will get lost the focus. So, this alignment is needed, especially for Bangladesh. We are thinking of that and the model adaptation clinic. Model adaptation clinic. What is that? That health will be there, the whole area. The farmers will be given the climate smart seeds, the latest technological information for the early warning system, because they are using the mobile phone. So by using 10 taka, they can get the information. And the insurance, climate insurance, health insurance, what will happen? Then they will get, that's not a huge money for individual, but initially for the premiums, government and the development partners can help us. And we have a very fantastic microfinance network. Through that network, we can reach the farthest one who is staying in the Sundarban area. We can reach them. Our area, we can reach them because we have the NGOs and with the microfinance instrument. Through that, we can envelop all those things in the microfinance. That is our adaptation clinic. What we are seriously, almost the modeling is complete. We need fund. We can implement it. We can go for implementation. That will be very helpful for, and because Bangladesh is vulnerable at the same time, we're the model of resilience too. Thank you.
Thank you. We're working in Bangladesh, and what's interesting is it's the agriculture sector that is paying for a health intervention because it's impacting their workers. And they're really seeing it as through an economic lens and a productivity lens, but the ultimate outcome is a health outcome. And so Bangladesh really truly a model for what's working. So congratulations, and we're excited to keep working with you. I'm going to go to Ajay again before I go to you, David, because I'll give you the last word, okay? So Ajay, Asia is one of the most vulnerable regions when it comes to climate change, especially on our health. And so when you're thinking about the future and you're thinking about the climate and health nexus as a climate funder now, how are you operationalizing this through your project design and appraisal processes?
Yeah, as I mentioned before, that climate is in the gene of AIIB.
Yeah.
I mean, we are, every
You're not AIIB anymore. You're just the climate funder or climate
exactly,
fund.
exactly. So I'm glad that we
Rebrand.
are right. So the climate, we have any project that we do, including the health sector, climate is mainstreamed in the entire consideration. And as I mentioned before, that every project that we do, the health project, or whether it is a energy, or whether it is a transport or sanitation, because what we find that many of these things are linked. The housing, for example, the sanitation, urban, the sewage treatment plant, the drinking water, all are related to health. So if we are able to, tackle and have a very, very holistic approach towards the entire the drinking water, sanitation, and the health, preventive health, and build our entire strategy, along with that, then we are achieving in that we are going in that direction. So if you look at our profile, the project profile, we are in fact, I was in the one of the panels here. It was on the climate and housing, and particularly the low income and the low middle income families. How do we get to good affordable housing, which is the climate friendly? So when we are talking climate friendly, it has to be the hygienic and plus energy efficient. Many things become part of this. Similarly, the water supply again is very important. So how do you create that safe drinking water? And we have invested in many projects in that area. So when we are saying that we are working in health, we are not taking a very narrow definition of health, but we are taking a very, very holistic approach.
Thank you so much. And so David came out with this report with AIB. How are you using the insights in Gavi's day-to-day work now and into the future?
Yeah, good question. And actually, there were three things that I want to say, and I think they've all been very eloquently said by my colleagues across the panel, because I do think that we're hearing very common messages about what we can do working together on. So for me, those three things, I think, firstly, is we really have to put a climate lens on every investment we do in health. And that really means looking at whether we can make every health intervention that we're making as climate proof as possible, both for adaptation and for mitigation where we can. And that's why certainly this framework that we're launching today in the report is so helpful for Gavi. We've used it to take a look at our next 5-year plan, because Gavi operates in 5-year cycles, so that we can help to shape vaccine markets and also help give countries more certainty towards their own plans. And we think of the roughly the $10 billion that we plan to spend in the next 5 years, $2.2 billion will be spent on addressing climate sensitive diseases through vaccines. And I think with the benefit of this report, around 30% of that impact will directly offset the changes we're seeing in disease patterns because of climate change. And so I think really having that lens helps us do the second thing that I wanted to come on to mention by Agnes, AJ, and Sohel, which is stronger partnerships. Not just doing this alone. I think in the health sector, we need to see much more what we're seeing in this panel, which is global health institutions like Gavi, the climate funds, I think, as well, the MDBs, the DFIs, working collectively in support of countries' national plans and priorities. We need to make sure, as Sohel says, that health features strongly in national adaptation plans. But I think we can also do it in sectoral plans. I gave the example of the increase in malaria cases that were seen in Pakistan in 2022 after severe flooding there. One of the consequences of that was that Pakistan updated its national malaria strategy to make sure that it was climate sensitive and climate proof, would work in the future. So I really do think that mainstreaming of the links into national plans is really important. And then the third thing, and Agnes spent a lot of time on that, is innovation. I think we all need to invest in innovation. Sohel talked about challenges of fiscal space. We all know it's a challenging donor environment in the moment, and it will be in the future. So we need to do the classic phrase of more with less. And I think in health, the good news is that we can do a lot of things there. We're seeing new vaccine technologies. We hope to have a vaccine very shortly for dengue, for example, coming into Gavi's portfolio. We're also encouraging manufacturers to invest in more thermostable vaccines. And what that means is vaccines that basically don't need to be kept in such cold fridges, so that works well in rising climates. And if you look sort of even further into the future, not necessarily having vaccines through needles, but actually having them through patches. And you can imagine that is a much easier delivery mechanism, particularly in the most vulnerable places. And we've got to use those digital tools, information systems, tracking weather patterns, much quicker responses to outbreaks. And then I think something else that got in Gavi, we love to work with the climate funds and with partners like the AIB is on innovative financing mechanism. We've got a partnership underway with the AIB on a front-loading facility to give Gavi better, quicker response times next time there's a global pandemic or a big outbreak related to climate change. So there's lots that we can do, I think, if we work together.
Great, thank you. I think Sohail wanted to say one more
And
word.
then last, one more point I wanted to say, that is, OECD countries, they are extending their support. And they are saying that we are giving the climate finance. And we went through the website and gone through all the projects. We found that the claim OECD's was that only 14.76% money was for dedicated climate finance. 45% was climate components. Say $50 million project, 2 component $5 million. So they termed this whole project is a climate project. So, and another 40% is climate sensitive. That is furthermore. So we don't want to say this sort of, we need climate dedicated, health smart climate dedicated funds. Not the climate component, not the climate sensitive. Thank you.
Thank you. I want to thank all the panelists today for coming together to talk about this important issue. Climate is accelerating every single disease, and we have to think about the health outcomes when we think about climate action. And in fact, integrating and embedding health into climate action just raises the ambition further up. And so I'm going to end on this note. Health is not a cost. It is the best investment that you can make, and you have to consider climate when you're thinking about your health investments. So let's reframe the whole conversation, because climate adaptation, health outcomes, and development, we're all talking about the same thing, right? How do you rebuild the systems, the norms, and the institutions to withstand 21st century challenges, and climate change being our greatest challenge? So I want to thank everyone. I also want to just direct your attention to the report that's on your seats. Take a look at it and get in touch. We want to work together.